everybody. Good morning, everybody, and welcome to AM Impact on Your Health. AM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AM Impact on Your Health is heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AIM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and, of course, where we do encourage you to call in to join in. Today, folks, well, a real treat in store for you. I don't know if you were with us back on August 18th when part one of this gentleman's airtime took to our airways, at least. One of the most brilliant physicians you will ever come across, ill and had to find a way to cure himself. Of course, it all is as simple as healing his voltage, and only way he can describe it. His name is Dr. Jerry Tennant. He's the head of the Tennant Institute, and he will be back here this morning with us to talk about healing his voltage, part two. So, dial us up for the old show. Stay tuned for the new. You just won't want to miss Dr. Jerry Tennant, our featured guest today. If in the process of talking with Dr. Tennant, you want to call and ask a question or to make a comment, the number, of course, is and will be 412-825-6262. That's 412-825-6262. All right, another action-packed week. Let me fill you in on what's going on around here. On Wednesday, we're going to be graced with the presence of Connie Strassheim. She works very closely with Dr. Lee Cowder. She's just written a book entitled Create a Toxin-Free Body and Home, and she'll be describing how you do just that with us on our Wednesday show. And on Friday, with a couple of weeks to go for the launching of our TLS weight loss and diet control course, which we're going to be having on Saturdays, Patricia Szymanski is going to spend some time with us on Friday to once again rehash the entire way that TLS, the transition of lifestyle system, is going to be handled each and every week for a 10-week period. We'll really get into the nuts and bolts of that on our Friday show with Patricia. And if you're having weight issues, if you'd like to be able to control your blood sugar better, think about being a participant. We still have some slots left. Tastings this week. Well, we got two, really. I'm talking about Beresha Tastings, giving you the opportunity to try the coffee, the tea, and the sweetener. Faith Dologowski is going to be lecturing at the Carnegie Library on Wednesday the 17th at 6:30. Anyone there, this is on Mount Washington's Carnegie Library. Anybody who's interested in attending and having an opportunity not only to listen to her talk about making your harvest last all winter, you have the opportunity to taste the coffee and the tea and the lemonade while you're there. You can give her a call at 412-219-1156 or email her at faith@greenwithfaith.com to at least let her know you're coming. Now, another tasting I hadn't mentioned, we participate with JDRF. That's the Juvenile Diabetes Research Foundation, Walk for the Cure. And this year's Walk for the Cure is going to be this particular Saturday, just across the road from from Phipps Conservatory. A big field there. Tents will be set up. We'll be there. Dr. Angelo is going to be there. Dr. Lori is going to be there for Beresha Tastings. If you are in the area, if that's your zip code, you want to come out and really support JDRF, maybe take a walk for the cure, and when you're done or before you get started, have a taste of this wonderful stuff that Beresha makes. So that's JDRF, Walk for the Cure, this Saturday. The walk kicks off at 9. You'll want to be there beforehand to try our tastings. And then, of course, when the gun is finally sounded and it's all over, you may want to come back and try it for a second time. JDRF, Walk for the Cure. Next Monday, Tuesday, and Wednesday, 1 week from today, we start our eye treatment program. Our treatment protocol is a three-day treatment program instituted by ophthalmologist Ed Condrat, a Pittsburgh fellow that you all know very well. He's developed this 3-day program to treat retinal issues in particular. I'm talking about macular degeneration and diabetic retinopathy and glaucoma. These three really do claim a lot of vision as we age, and in the case of all three, really no treatment for any of those three conditions in the conventional world. Dr. Ed's program allows you to get this whole thing turned around and reversed and established to restoring your vision in 3 days. If you're interested in the program and would like to find out more about it, give us a call here at 724-942-3002. That's 724-942-3002. You want to talk to Sister Sarah, and she'll get you scheduled this with 1 week to go. This is probably the last day to catch the September 3-day program. Also should mention next week, Sven Hosmer is going to spend some time with us to go over his most recent publication. The fall version of Lifestyle Medicine is out. Plenty of great articles, a lot of the authors in here you know very well. We'll let him describe his new offering with us. He's with us on the 24th. Looking pretty good. Oh, I got to say, enjoyed spending Friday out there at Phipps. There's a lot of going on here this week, or at least the vicinity of Phipps, with the vaccine conversation that went on all day out there at Phipps, put together by Patricia Lemmer. We had her on our show here 1 week ago, last Monday, but she put together an excellent program, and we did have the opportunity, for the first time, as I found out, to have Barbara Lowfisher, the person who founded the National Vaccine Information Center, in attendance. It was wonderful to see her again. It was Barbara Lowfisher herself, first educating me in the mid-'90s on the issue of vaccine. She is quite the leader of this movement. More to come from her. I spoke to her, really enjoyed having a chance to speak with her. After the program was over, she consented to come on the show. I promised to get her scheduled in the very near future. If you haven't heard Barbara Lowfisher speak, you'll really enjoy that show. I promise to do it as soon as physically possible with her schedule in mind. Also want to mention, good friend in attendance, was not surprised in one way, but always nice to see Dr. James Weiner was in attendance there, as much as a role as he's played in educating you all about the issue of vaccines, serving as quite a beacon of that information and disseminating it. I thought I'd at least said, look, I had to tell everybody that I saw you out here, and he said he'll do likewise. Well, we'll see if he mentions me on one of his many radio shows today, but I definitely had to say a good word about the great Dr. Weiner. Now, I'm trying to get to our morning guest as soon as I can. There's just so much that this gentleman can teach you. You spent some time with him a month ago, August 18th, when he came here to talk about something he called healing is voltage. We had to label that part one because there's so much more I want you to know about healing is voltage. He consented to come back. Dr. Jerry Tennant is our guest this morning. Sit back, kick off your heels, get your legs up there on the recliner, and enjoy this brilliant physician describe how you get better by putting electricity in. We'll see what we mean in a moment. Be right back in a moment with Dr. Jerry Tennant.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
620 HP.
Good morning, ladies and gentlemen. Welcome back once again to AIM Impact on Your Health. Heard here in KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today on a Monday morning version of the show, and a well-anticipated show it is. You first met him a month ago when he brought to you a message of how to look at the body and how things can go wrong. He had to do it for himself, and they'll let him recap why, in fact, he had to invent this new way of speaking and this new way of tackling problems that can go wrong in the body. Of course, he simplifies it by calling it as healing is voltage. This gentleman is a brilliant physician, a genius, as a matter of fact, in my opinion. Completed high school at age 16, took 2 years of high school altogether, finished college in 2.5 years. Of course, got the Phi Beta Kappa at Texas Tech in so doing. At the hospitals, all the specialty work that's done at Methodist Hospital in Dallas, Parkland Hospital, and Harvard Mass Eye and Ear. The list goes on and on and on. His accomplishments are so many. I hope he won't hold me into account for not just talking about so many of them and having an opportunity to have him back with us today. I'm going to welcome him once again. Dr. Jerry Tennant, thanks for coming aboard this morning for our Pittsburgh audience.
Well, good morning, Dennis. Thank you for having me back again.
Well, we just had to do it, Dr. Tennant. There's just such an interesting way that you view disease and how to fix it. And I have had more comments on the show than any other show I've ever done. I want you to know that, by people who were just mesmerized by how you've looked at things. And I would like, if you could, to just rehash a bit. First of all, I think your story is so compelling. You literally had to sit back, you said, and figure out a way to fix yourself because you were pretty ill for quite a while. That led you to the discoveries. And if you could, maybe we should start there. Why is it that we have this unique way of looking at the body and how things can go wrong? Because they went terribly wrong in your case. Could you please recap that whole event for us?
Sure, thank you. Well, as you mentioned, I'm trained as an ophthalmologist, and I did eye surgery for about 30 years. And one of the fun things I got to do was I did most of the research for the laser that's used in LASIK surgery for the company called Vissix. And although I had a lot of fun doing that work, one of the things we didn't know is that the laser wouldn't kill viruses. And one of the patients I treated was a fellow from India who had some scarring on the front of his corneas. And so I was using the laser to trim off those scars. And as I did so, the laser released the viruses, and they came up through my mask and through my nose and into my brain. And so I developed encephalitis. And basically what happened is I got to where I could see a patient and know what was wrong with him, but I couldn't remember how to write a prescription. And I also developed spastic movements and a bleeding disorder. And so for all those reasons, including overwhelming fatigue, I had to quit work at the end of 1995. So I sought out the best doctors I could find, and they all said, well, you have viruses in your brain. We don't know what to do about it, so good luck. So I had 2 or 3 hours a day in which I could think clearly enough to understand a newspaper, and then like a light switch would go off and I couldn't understand it anymore. So during those 2 or 3 hours a day, it became apparent that I had to figure out how to get myself well or it wasn't going to happen. So the thought came to my mind that if I could figure out how to make one cell work, I could make them all work. And so I bought some cellular biology books, which I hadn't read in about 30 years, and began to read through them, and came to recognized that in each of the books talked about the fact that cells have to run at a pH of 7.35 to 7.45. Well, I didn't remember a whole lot about pH except that it had something to do with acid-base balance. So I started reading about pH and discovered that pH is really a measurement of voltage in a liquid. So if you think about the electrons that are coming into our home at the moment or into your car as you're listening, they're going through a copper wire and either your switch is on or off. But if you talk about a liquid, then that liquid has the opportunity of either being an electron donor or an electron stealer. And so, as a matter of convention, if you take a sophisticated voltmeter and measure the voltage, if the voltage in it is electron stealer status, you put a plus sign in front of the voltage, and if it's an electron donor, you put a minus sign in front of it. So you then take the voltage you measured, convert it to a logarithmic scale from 0 to 14, and call that pH. So plus 400 millivolts of electron stealer is the same as a pH of 0, and minus 400 millivolts of electron donor is the same as a pH of 14. So what that meant then was when the books say that cells must run at a pH of 7.35 is a synonym of saying that cells must run at minus 20 millivolts of electron donor, and then 7.45 is minus 25 millivolts. So all of a sudden it made a whole lot of sense that cells have to have energy to work. Now, I should mention that sometimes people get confused because if you put a cell in a petri dish and put an electrode inside the cell and one outside the cell and measure across the cell membrane, you'll often get a voltage of around minus 90 millivolts. But since our cells in our body aren't in a petri dish, our cells have to run in an environment of minus 20 to minus 25 millivolts. Well, the next issue, of course, was, okay, how do I measure it? And I discovered that a Japanese chap named Nakatani was the first person to use modern electronics to measure acupuncture meridians. And so I bought his rather rudimentary equipment and measured and found that my brain was running between minus 2 and minus 4 millivolts instead of minus 25 millivolts, so now I knew why it didn't work. So the next issue then was to figure out what to do about it, and that began my journey of understanding a totally different way of looking at how the body works and how it gets sick and what you have to do to get well. So one of the key ingredients of my figuring out how to get well was to recognize that the body's constantly wearing itself out. So you have to replace the cells in the macula of your eye every 48 hours. The lining of your intestine is replaced every 3 days. The skin you're sitting in this moment is only 6 weeks old. Your liver's 8 weeks old. Your nervous system's 8 months old, etc. So as we wear cells out, we have to make new ones. And, of course, if you have injuries or if you have infections or if you have some sort of toxins that damage cells, you have to replace all of those as well. So I came to the realization that chronic disease occurs when you lose the ability to make new cells that work. I think that's important enough I should say it once again. Chronic disease occurs when you lose the ability to make new cells that work. Well, that obviously led me to the question, well, what's it take to make a new cell? And I came to realize that not only do you have to have twice the voltage to make a new cell as to run it, that is to say you have to have minus 50 millivolts of energy to make a new cell. You also have to have all the materials it takes to make one. So whenever you have an illness, one must simply go down the checklist of the things it takes to make a new cell and discover which things are missing or which toxins are present, keeping you from making new cells, and then you understand what you have to do to get well. So that's kind of where it all started and where we have come to. And if you like, I can continue this narrative, or you can ask me some questions at this point.
Well, I just wanted to let you go. I thought that the way you recapped it was it's a little different each time I hear it, and it just gives me a different perspective. The one I got from this particular explanation, let's see if I'm an okay student of yours, Doctor. When it comes to getting better, it's these cells, they're going to turn over anyway. And why try to fix some cells that are gone completely kaflooey? If you can get ready and prepare yourself for the next batch of new cells, you got your best chance to get things back and establish and on the road to health again. Did I catch that right?
I think so. One of the buzzwords that's been around for a while is stem cells. And, of course, most of the stem cells in our body, well, first of all, most people don't even know that we have an inventory of stem cells for every organ system in the body. Most people think about, well, you've got to either inject some or figure out how to make some. But we really have some partially ready, partially prepackaged, if you please, stem cells for every organ sitting there waiting to be activated. And when we make new cells, we're primarily making new cells from stem cells. We're not making them from old, worn-out cells. So what we have to do is to switch on those new cells, those new stem cells, and replace the ones that are worn out. So that's the way we're designed. The other thing I might just mention is if you think about my thumb, as I sit here, it's a perfectly good thumb. So it's running at minus 25 millivolts. Now I hit it with a hammer and I destroy a bunch of cells in it. And so obviously I have to make new ones to replace those I damaged with the hammer. Well, when you have an injury like that, the thumb automatically goes to minus 50 millivolts because that's what it's going to take to make new cells. But also, when the body hits minus 50 millivolts, it dilates the arterial capillaries. And the reason that happens is, of course, it's so you can dump all the materials you need to make cells at the curb, so to speak. And so when those arterial capillaries dilate, you get all the signs that we normally call inflammation. So those dilated capillaries make the thumb warm. It makes it swell up. It makes it have a pulsing pain. It makes it red, and usually it makes you say bad words. So now you've got what you need. You got the minus 50 millivolts of energy, and you got all the materials it takes to make cells, and so you get busy replacing all those you smashed with a hammer, and then your thumb goes back to being normal. It's now back to minus 25 millivolts, and it's a perfectly good thumb again. So that's the way things are designed to work. However, if when you hit your thumb with a hammer, you don't have 50 millivolts available, or you have 50 millivolts, but then you run out of voltage before you finish making all the cells you need, now your thumb drops down to something below 20 millivolts. Let's say it's minus 15 or minus 10 millivolts. Now you're in trouble because your thumb is now pale, it hurts all the time, and you can't get it well. And the only way you can get it well is to make new cells, and the only way you can make new cells is get up to minus 50 millivolts and have all the parts it takes to make cells. So at that stage, you're stuck in chronic disease, aren't you?
Yeah.
So when you're stuck with the low voltage and inadequate materials to make cells, you can take all the pills you want, you can do all the surgery you want, you can do whatever you want, but you're not going to get well because you can't make new cells. So that's the definition of chronic disease. As I've mentioned earlier, you've lost the ability to make new cells at work. So the solution, of course, is to go through the checklist and see what you're missing, and essentially always you're missing voltage. But you may also be missing all the things, or some of the things that it takes to make new cells. And that's what I say, you have to go through the checklist of everything it takes to make make cells for each individual in order to figure out why they can't make new cells. And once you figure that out, give the body what it needs, it knows how to fix itself.
Now, before I get to that checklist, because I think I really would love to hear you zip through the checklist as you see it, a couple other things that come up. I asked you last time what you thought was your aha moment, because there you were so ill from your encephalitis, and really, I think the thing you didn't say this time, that was 6 years of agony that you were going through. 6 years. My listeners are probably wondering, my goodness, how could somebody bear up under all that? But be that as it may, I said, Dr. Tennant, what was that aha moment when you knew you had discovered really what was going on here? And if I remember correctly, you said, look, besides me having that brain that was really not working well, my foot was killing me, and my spleen was huge. And when I found out there was something that connected all those, that was my aha moment. Could you talk about these things that you call circuits? Because I felt that was a tremendous find that you made, and I never heard anybody put it that way before.
Yeah, not only did I have a brain that didn't work, but I had a lot of other symptoms. I felt like somebody was sticking an ice pick in my left big toe. So I went to see my friend, the neurologist, and Tom said, you have idiopathic neuropathy. Of course, we know that the word idiopathic means I don't have a clue. And my spleen would swell up and hurt. I had terrible stomach pain with indigestion. I had some aching in the left side of my cheek, and then eventually I started having double vision with a scar in my left macula. And so, of course, in traditional medicine, you would never figure out that all of those were caused by the same thing. What eventually I was able to understand was that first of all, we are a portable electronic device. The human body is a portable electronic device. And like all portable electronic devices, we need battery pack to keep us working when we're moving around. So what is that battery pack? Well, muscles are what are called piezoelectric. So what does that fancy word mean? If you were to take a piece of quartz and squeeze it with a pair of pliers, it would emit electrons. And that phenomenon of emitting electrons when you stress a substance is called piezoelectricity. Well, every time you move a muscle, it generates electrons. And so movement of our muscles is the way we are designed to recharge our own battery packs. And our battery packs are those very same muscles, and that is that muscles are rechargeable batteries. And so then the next piece of the puzzle is that that listening white tissue that you see surrounding muscles when you carve the Christmas turkey is called fascia. And fascia is electronically a semiconductor, which basically means a collection of molecules that will move electrons at the speed of light, but only in one direction. So around all of our muscle batteries, we have this stocking of fascia that moves electrons from place to place. The fascia is our wiring system. Now, it turns out that each organ in the body has a very specific stack of muscles that is like the same as putting a stack of batteries in your flashlight that provides voltage for each and every organ. And those stacks of muscle batteries are what we have heard of as acupuncture meridians. Acupuncture meridian is simply a stack of identifiable muscle batteries providing the power for the ongoing function and the ability to make new cells for every organ system in the body. So just like the battery on your car, if you think it's low, you can go out and take a voltmeter and put it on the poles of the battery. Or you can take a battery like you put in your flashlight, and it has a pole on each end of it. You can put your voltmeter on each end of that or on your car battery and measure its voltage. Well, there are specific spots on our body that are the poles, that represent the poles of each And so with the device we have developed called the biomodulator, you can go simply tap onto those poles and measure the voltage in every organ. And once you know whether it's minus 20 millivolts, which tells you it has adequate voltage, minus 50 millivolts, which tells you it's in the process of healing something, or, heaven forbid, it's lower than 25 millivolts, so that means that organ is struggling, trying to keep itself running and keep itself repaired. And so you have a very simple and easy way to go check the power supply for every organ, and then you know what's working and what's not working.
Now, I thought that the connection of the circuitry was just a brilliant find, and you're right, the conventional world just couldn't connect your toe to your spleen, to your brain, and certainly your macula. But the role that the dentistry plays, I thought, was another uncanny component, because was it not that I hear it right that the circuitry that you felt may have gone awry in your own case was passing through a root canal tooth?
Absolutely. The only reason I got sick was I had a root canal in tooth number 14, which is basically a molar on the upper left. You see, each of these circuits that I've described, or these battery packs, pass through a tooth, or multiple teeth, actually. And so when you get infection in a tooth, it serves like a circuit breaker and shuts off that circuit. So if you come home from work and you go in and your kitchen light won't turn on and your refrigerator isn't working, and then you go in the living room and your lamp won't turn on, and you go into the bedroom and the light switch won't work, that's very obvious to you that you've got a circuit breaker out. And so you go out in the garage and you look and see which circuit breaker's flipped. Well, we have the same problem in our body. For example, the system I described for me personally is on what's called the spleen and stomach circuit. And what I mean by that is that every organ system in your body is involved with a battery pack where the electrons flow either from a hand or a foot upward, and then it connects to another circuit that flows back down to either that hand or foot. So the spleen circuit starts in my big toe, goes up the side of my leg, goes up through my spleen, goes up to the frontal lobes of the brain, and then it connects to the stomach circuit, which goes to the eye, which goes back down to the stomach, and then down through the genitalia, the prostate, etc., back down to the big toe. So again, in traditional medicine, we would never ever figure out that pain in my left big toe had anything to do with the fact that I couldn't think anymore, or that I had a scar in my left macula, or that my spleen and stomach didn't work. But when you understand that they're all on the same power supply, just as they are in the home description where your refrigerator doesn't work, your lamp doesn't work, and so forth, it's all on the same circuit, and what most commonly flips a circuit off is a dental infection. So 48 hours after I had that root canal pulled, my bleeding disorder went away. My platelet count went from 30,000 to 150,000, and normal's 150 to 350. So in 48 hours, my bleeding disorder was cured by simply pulling the tooth. Also, my brain began to work again. My spleen quit swelling up. My stomach problem went away. My toe quit hurting, etc. So the only reason I got sick was because that root canal dropped this voltage in that circuit. And when you drop the voltage, a cascade of things happen, including getting infections. You'll recall that I was able to get viral infections from doing laser surgery. But the reason I was able to get the viral infections where another doctor doing the same surgery might not is my voltage had dropped so that my system no longer could defend itself against the invading virus.
Boy, that's just brilliant thinking, and as much as I've admired the whole, Oriental medicine of describing energy, the word energy, is somehow amorphous when you put it in terms of electricity and current and wires, and it makes this whole thing understandable to me. And I'm just going to guess it makes it very understandable to most of my listeners too. And never heard that explanation before. It really, my hat's off to you, Doctor. It's certainly made a better student out of me than heretofore had ever been even possible. The ability to get this body of yours back, you say, always you need to follow a checklist when you're forming new cells, because ultimately it's going to be these new cells that pick up the gauntlet for the cells that hadn't been working too well because they weren't, their construction just didn't allow them ever to get better again. I'd like, if you could, to maybe move to this checklist, because my listeners are going to be on bated breath here, waiting to hear how it is that you make certain that your next batch of cells is going to be able to fill in the deficits of the previous cells that aren't working right.
Sure. One of the things you have to realize is that one of the major controls of voltage of every cell in the body is thyroid hormone. And you have to get the thyroid levels correct, and you have to get its buddy, the adrenal hormones, correct. Because if you don't get that, nothing else seems to work right. So the thyroid cascade begins up in the hypothalamus of the brain, which, by the way, is under control of adrenal hormone adrenaline, which, of course, is one of the reasons you have to get that right as well. So the hypothalamus makes a hormone called thyrotropin-releasing hormone, which then tells the pituitary gland to release the thyroid-stimulating hormone, which tells the thyroid gland to release the hormone T4. But then T4 has to be converted to the active form of T3 using a series of things. Namely, you have to have iodine, selenium, zinc, iron, progesterone, cortisol, vitamin C, and if you are missing one of those guys, oh, by the way, you have to have glutathione as well. And if you're missing one of those guys, you make a fake hormone called reverse T3. So the active hormone T3 controls voltage at the cell membrane, but then it's converted to a hormone called T2, which controls voltage of the mitochondria inside the cell. Well, there's a big problem about correcting thyroid in this country because doctors are trained to look primarily at that hormone called TSH, or thyroid-stimulating hormone. And if that is found to be normal, doctors will say, well, your thyroid's fine. Well, it may not be fine because you can have a normal TSH and be 80% deficient in T3 and T2.
Wow, 80% off.
Yep. And then that's compounded by the fact that our labs are 10 years late updating their normals for TSH. The TSH test was invented in the late 1960s and put in place in 1971. And it was done poorly because when they figured out what normals were for TSH, they only looked at 29 patients, which is an inadequate sample to give you statistically accurate normal. But that's what they did. They said normals are 1 to 10. And they told doctors, adjust your thyroid patients' thyroid doses so your TSH is between 1 and 10. So most of the doctors had to cut their thyroid patients' dose in half. And not then, or even up to this present date, has anybody ever done a study to see how patients feel by adjusting the TSH test. Well, over time, they did figure out that 1 to 10 wasn't working too well, and so they kept changing the normals. And now, almost every doctor that gets a lab report says normal is 0.4 to 4.6. Well, in 2003, the Academy of Endocrinology said that that normal should be 0.5 to 3.0, and that same year, chemistry said it should be 0.3 to 2.0. So basically, you go see your doctor and your TSH comes back at 4, your doctor will tell you it's fine because it's less than 4.6. But it's not fine, it's twice normal. It should be less than 2. So we've got two problems with the TSH test. One, the norms that are being printed on doctors' forms are 10 years out of date. And secondly, even if it were below 2, if you can't convert, you still are hypothyroid. So the estimates of how many people are walking around that are really hypothyroid but their doctor missed it varies up to as high as 80% of the population, which is absolutely crazy. Well, anyway, so what you really have to do is sort of ignore the TSH test and get what's called a free T3 and a reverse T3. So see how much of the active hormone you make and how much of the fake hormone you have. Because if you have lots of the fake hormone, it takes up the receptor sites, sort of like a key that fits in a keyhole but won't turn the tumblers. And if you have high levels of reverse T3, that's been shown to be a primary cause of chronic depression and bipolar disease. Well, so you got to fix the thyroid. And by the way, one of the problems is that docs are trained to use to prescribe just T4 levothyroxine, which is often known by the trade name of Synthroid.
Synthroid, yes.
So let's assume that you're iodine deficient, for example, or you can't make glutathione because you don't have stomach acid, etc. And a doctor says, "Oh, you're hypothyroid. Here, take this pill that has T4 in it." And so you take the T4, but you can't convert it to T3, so it doesn't work. So you go back to the doctor, and he says, "Well, let's increase the dose a little bit." So now you have more T4, which means you make more of the fake hormone, reverse T3. So every time your doc increases your dose, you get worse. And so even though you're hypothyroid, it doesn't get fixed. So that's a common problem. So for some reason, which appears to be primarily financial, doctors who prescribe desiccated thyroid, which is commonly known as armor thyroid, get harassed by all sorts of different bureaucratic things, even though it's the one that works because it already has T3 and T2 in it. Well, the second part of the problem is I mentioned that thyroid hormone has to be accompanied by its buddy, the adrenal hormones. Thyroid and adrenal are like two horses pulling a wagon. Those horses have to pull equal or your wagon goes in a circle. And so you must, at the same time that you correct thyroid hormone, you must be sure you have enough adrenal hormone to go with it, or it doesn't work well either. Now, the adrenal glands are actually two glands in one. The outer gland makes cortisol and aldosterone. Cortisol has to do with regulation of blood sugar and inflammation, and aldosterone has to do with how much sodium and thus how much fluid your body retains, and thus affects the upper number of your blood pressure. The inner part of the adrenal glands makes a hormone called adrenaline. And adrenaline has a huge effect on the way your body functions, including being the primary controller of the lower number of your blood pressure. But when you don't have enough adrenaline, not only does your thyroid not work because your hypothalamus doesn't work, but you get into the following slippery slope. Without enough adrenaline, you can't deal with stress. You begin to have trouble with your memory, and then you can't multitask. So you're sitting reading a book and somebody says, "Hey, you want mustard or mayonnaise?" First of all, you become very annoyed because they interrupted you. Secondly, you don't have enough mental capacity to stay attached to your book and figure out whether you want mustard or mayonnaise, so you detach from your book. You make the decision, you go back to your book, and now you can't remember your place, and so you're even more annoyed. And then it gets to where you can't stand any stimulus. So you don't like loud noises, you don't like loud music, you don't like rowdy crowds, you can't be around people who are arguing. And then eventually it gets to where you don't even want to be touched, and you just want to sit in the corner and have people leave you the heck alone. And then your sexual equipment quits working, and you can't go to sleep before 11 o'clock, and when you wake up in the morning, you're still tired. All of that slippery slope is due to lack of adrenaline. Well, if you think about the scenario I just described, that is terribly destructive to a person, because if every time you want to, or somebody wants to interact with you, you get angry, pretty soon people don't want to interact with you at all.
Mm-hmm.
And so you can't be a good husband, you can't be a good wife, and of course if you don't want to be touched and your sexual equipment doesn't work, that interferes with that process. You can't be a good parent because kids want to interact with you, and kids are noisy, and you can't stand noise, and every time you hear noise you become angry and strike out. You can't be a good friend, you can't be a good worker. Basically your whole life goes down the tubes simply because you don't have adrenaline. So one of the primary things that burns out your ability to make adrenaline is stored emotions. Emotions get stored in our body as magnetic fields, and so when you have a traumatic event, it will get stored in one of your circuits, and depending on which circuit it gets stored in, you have a different emotion. So, for example, if it's stored in the liver gallbladder circuit, you're angry all the time. If it's in the kidney bladder circuit, you have fear. If it's in the spleen stomach circuit, you have worry, etc. So which emotion tends to be your predominant one depends on which circuit that magnetic field gets stored in. And by the way, with our biomodulator frequencies, we can get that magnetic field erased and get rid of that emotion in about 5 minutes. Well, nevertheless, the point is that you have to have adrenaline, and the other thing about making adrenaline is that to make adrenaline, you need the amino acid tyrosine, vitamin C, and vitamin B6. So there's both an emotional part of burning out your adrenals, and there's a nutritional part of burning it out. So one of the checklists that you have to do as you begin this process is not only fix thyroid, but look and see whether or not you have enough adrenaline. The clues for adrenaline are the checklist of emotions that I just listed for you, plus you can look at the body temperature. If your body temperature is below 98.6 first thing in the morning, and let's say it's 96.8, that means you don't have enough adrenaline because the temperature center is in the hypothalamus, which is under control of adrenaline. And if your blood pressure, the lower number of your blood pressure is below 80, you have enough adrenaline. Well, the reason people don't have enough tyrosine to make adrenaline is because you don't have stomach acid. When you eat a protein, stomach acid is supposed to break those proteins into amino acids, including tyrosine. So if you're on drugs that shut down your stomach acid, then you're going to get to where you can't make adrenaline, and then your life's going to fall apart. Well, so we've started down the road of the checklist. You have to fix thyroid and adrenals. If you don't get that right, nothing else really works. So that's kind of the basics. Then the next thing you do is to look at which circuits measure low voltage, and also then you go measure the teeth, because other than thyroid, the main thing that makes people sick is a dental infection. Now you can take just a standard voltmeter that you can buy at Radio Shack or Lowe's or any of those places that measures in millivolts, which means you got to pay about $40 for it instead of $10. But you take that voltmeter and you put one electrode up against the cheek and the inside of the cheek, and the other one on the metal filling or metal crown. And if it measures over 100 millivolts, you can take it to the bank that there's decay under that filling or under that crown. And then, of course, the next trick is convincing your dentist that that's the case, and then getting them to take that crown off and get the infection out from under it, or remove the filling and get that fixed. But worst of all, of course, is to have a root canal. way you do a root canal is that you drill a little hole in the top of the tooth, and then you reach an auger down in, and you rip out the artery and rip out the nerve and kill the tooth. Well, the dentists are the only physicians that believe you can get away with leaving dead tissue in the body. No other doctor believes that. The problem is, of course, that all dead tissue left in the body becomes infected. And so one root canal tooth shuts down 63% of your immune system, according to work done by Dr. Boyd Haley at the University of Kentucky. And the toxins that are put out by a root canal tooth match in severity the standard by which all toxins are measured, namely hydrogen sulfide. So I mentioned to you that I got sick and spent 7 years in bed just because I had one root canal tooth in number 14 in my spleen-stomach circuit. So, I would have been long since dead had I left that tooth there. But 48 hours after the tooth was pulled, I started getting well. And that's what I see day in and day out. In fact, I did a little study out in Phoenix with a friend who's an oncologist. We looked at his cancer patients, and what we found was that 70% of his cancer patients had a root canal in the same acupuncture circuit as their primary cancer, and 30% had an infected crown in that circuit. And the average time from dental procedure to the malignancy diagnosis was 7 years. So some sooner, some longer, but nevertheless, that's the problem. So, dentists keep saying, well, we use a laser and we sterilize the tooth, and then we put some magic material in it which keeps it sterile. That's nonsense. The tips of the tooth, of the roots, are still attached to the lymphatics. Plus, they're surrounded by active bone, et cetera, et cetera. So it's still attached to the rest of the body, plus it's also attached through the acupuncture circuits. And so any dead tissue is going to get infected no matter what you do to it. So if your big toe dies and you leave it there, you'll die from gangrene. If your appendix dies and you leave it there, you'll die from peritonitis. If your tooth dies or gets killed by doing a root canal procedure, it'll kill you as well. It just takes longer.
Wow.
So probably somewhere around 80 or 90% of the people who come see me, and by the way, about 80% of my patients come from other states, and most of them have been sick for 5 to 15 years. And almost always I find that one of the root causes of them being sick is a dental infection in the same acupuncture circuit as the whatever organ they're complaining of. And, of course, the reason they're sick is because the tooth acts like a circuit breaker, drops the voltage in the power supply to that organ, and when the organ doesn't have enough voltage, it can't run efficiently if it's below minus 25 millivolts, and it can't repair itself if it can't get up to minus 50. So it's fairly straightforward and fairly simple paradigm, but it just simply works, and there you have it. It's easy to go figure out what's wrong with every organ simply because if it can't maintain itself, it gets sick. So as we've been going through the checklist, we've gotten most of the things that affect voltage, except we haven't talked about scars. When you put a scar across a circuit and it touches the fascia, it creates a short or a ground, and so that tends to drain off some of the voltage. And the way you know that a scar is having an effect on an organ is you simply test the strength of your muscles and then take your index finger and middle finger of one of your hands and put it on the scar and then test your strength again. And if you go weak, when you touch that ground or that short, it tells you that that's exactly what it is. Then you simply we have an essential oil blend that I put together. We put that essential oil on there, and then we use the attachment to the biomodulator. It takes usually about 3 minutes, and we realign the molecules in the scar. So now when you touch it, you're strong instead of being weak, and that allows the voltage to recover in that circuit. So what you'll see if you take time to do the chronology is a kid falls off their bike when they're 6 and get a scar on their leg. That begins to lower the voltage in the associated teeth that are on that circuit, which drops the effectiveness of the pump that's inside a tooth that keeps it from getting decay. So then you get decay in that tooth, and then over time you get the filling replaced, and you get the filling replaced, and you get the filling replaced, and then you get a crown. And now you're 40 or 50 years old, and now that organ begins to fail because the infection under the crown drops your voltage, and you get sick. And you can date a lot of these adult illnesses back to when you fell off the bike when you were 6.
Fascinating. I could listen you tell these stories forever. The research that you've done, this thing with the connection with the cancers, just blew me away. That's such new research. Who would have ever figured? Was it 70% of the cancers are associated with the root canal?
Yep. I've seen 7 malignancies since I figured this out that I could not find a dental connection. So there are other things. Radiation will cause cancer, obviously. Smoking does it. Petrochemicals will do it, and so forth. So there are some other things. But I've only seen 7 cases of malignancy where I could not find that a tooth either caused it or at least was contributory to the problem. And then if you look at some of the cancer research that's been done over the years, for example, Keith Brewer showed that to get a malignancy, you have to flip the polarity. So you have to drop the voltage from minus 25 to plus 30 millivolts, and that's when cancer occurs.
There it is.
And that fits in with the recent work that was done up in Boston by Thomas Seyfried, showing that all malignancies are driven by low voltage, namely low ATP, and that it's not driven by genes, as we've always been taught.
Doctor, we have come to the end of our time. I want to thank you so much for allowing me to invade you one more time by coming back. I intend to be one of your up-and-coming classes. I think December is the only one that works for me. We will meet again, and I'll have you back on the show again. Do you mind, Doctor?
Be happy to. Thank you so much.
Thank you so much also. There you have it, ladies and gentlemen. Dr. Jerry Tennant, and his way of describing diseases that he put together on his own. Hey, look, thanks for spending time with us today. I'll be with you on Wednesday. So until then, this is Dr. Dennis Courtney saying so long for AM Impact on Your Health.
AM Impact on Your Health is sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, M.D. 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 M.D.